do is, very quickly is, there are books and books I read, but there are so many books I go back and read. Okay, and you must have, at least some of you must have heard of Simon Sinek, and you must have read some of his books or heard his TED Talks. His TED Talk is, I think, rated number 2, the third most, 43 million viewers for a TED Talk, and it was based on the why question. And a number of years ago, I read this book, and I went back and was rereading some of the principles behind the why question. I just want to sort of very briefly share with this why question for you, because this why question is terribly important for a lot of people in our organization. And I will frame it in such a way that you will begin to understand what is the why that actually drives you. Okay? It is not the why of the organization, what is the why of your personal drive that actually drives you. He framed this question through circles. What do you do, how do you do it, and why do you do it? The most important question is, why do you do it? That is the purpose of why you do it. And then there is a physiological and neuroscientific explanation as to how our brains actually come around this why question. And this is again from his book, The Golden Circle in the Human Brain. Okay, and I just want to sort of read a couple of quotes that he has written. These are his quotes, these are not mine. Every one of us has a why, a deep-seated purpose, cause of belief that is the source of our passion, our talents, and our inspiration. The difference between happiness, listen to this very carefully, the difference between happiness and fulfillment is the difference between liking something and loving something. Liking something and loving something. And happiness comes from what we actually do. The happiness in serving ourselves is real. I mean, when you eat a nice meal or when you do something pleasurable, that is real. But that feeling of that comfort and enjoyment is not long lasting. You eat a nice meal, once you're full, that's it. Okay? However, the real lasting fulfillment comes from actually doing something for somebody else and seeing how you have made a difference in the lives of another person. And that's a lasting fulfillment. That is not happiness. So there is a difference between happiness and fulfillment. And they say that every organization, every individual has this why in us. We all have our individual whys within us. But many of us haven't sort of deep, dived to find out what the real why that drives us is all about. We come to work, we do our work, we go home, and that's kind of an automatic life. And we really haven't discovered the why in us, and sometimes the why in the organization. A lot of people still work in this organization and really, truly do not understand the mission of the American Mission Hospital. Why do we exist as a healthcare organization? Is it about making money? No. Is it about outstanding healthcare? Yes. Is it about an inclusive healthcare? Absolutely yes. So there are certain things that are core values that drives our mission together. And you can see the why is your purpose, your motivation, what you believe in. How, and in an AMH or in any healthcare organization, the how is all the processes and policies we have to do this well, exceptionally, efficiently, and effectively. So that's the policies and the processes that structure plus process equals outcome. So we structure it in such a way that we always have the best outcomes, and that's the processes. Essentially, if you ask the what question, what do we do as an organization? That's easy. Oh yeah, we are AMH, we are a healthcare institution. But the key thing is the why question. If I ask, Manoj, why are you here? Is it just for a job, or is there a greater purpose? You ask Todd, why are you here, Todd? You could work anywhere else. Why do you come to the American Mission Hospital? And why are you committed to spend your time, your career, your life in this place? So the why question drives pretty much everything that we do. like any organization, AMH also, the employees of AMH are spread out. 600, if I take 600 employees and throw it into these three circles, I would say about 10 to 20% of the total staff understand the why. Let me repeat it. 10 to 20% of our staff are in the why circle. And when I mean by 10 to 20%, if you take 600 employees, I'm talking about maybe 60 to 100 employees understand the true why of why we are here. And another 20% of the employees are caught up in this, how we do it. This is a policy, I need to follow this policy. This is what Miss Elise told me, so I follow what Miss Elise told me. Okay? Even though common sense tells you that you need to do something different, there's a policy, but either there's something that is outside of the policy, or no, I'll stick to the policy. Because that's what a policy tells me to do. So there are a lot of employees who are caught in this house circle. And the majority of employees, not just of AMH, of any organization, I just caught in the outer circle of what? What do you do? I work at AMH. Why do you work at AMH? Oh, it's a job for me. Why do you work at Amtrak? I need a job. I work at Amtrak. So it is, for me and for everyone, how do you take the people who are trapped in the what circle and the house circle and push them deeper so that they begin to understand the real why of themselves? First, they have to understand the why of themselves. There's no point in teaching anyone to understand the why of anything. They have to understand the why of themselves so that they can then begin to understand the why of the organization. Pretty much, organizations fail by some CEO coming and saying, wow, we're going to do something great today, and our new strategy for 2022 is going to be patient experience and employee self-development. You know what? For the people in the why, that makes a lot of sense. But people in the how, they will look at that and say, okay, how are we going to do it? What policies are going to come up to help us to do that? And people in the what, yes, this is another set of nonsense. I need to clock in, I need to clock out. So the question is, why are some people stuck in the what? And why are people in the how? They're asking quite intelligent questions. Why can't they move from this middle circle to the why circle? And in lots of ways, my whole life now is committed. Whatever little time the good Lord has given me at AMH or outside, I'm committed to actually come alongside people and push them to discover their why in their life. There's a purpose for your existence. You just don't hang this around your neck and walk around. And yet, when there is a patient sitting in front of you, you can't be on your mobile phone with a patient sitting in front of you and you're looking at your mobile. In my culture, I'm talking about my culture, if my father walked into front of me, I would immediately stop whatever I was doing and I would stand up. I could not sit down in the presence of my grandfather, for example. That was the respect that was given. There was nothing like, hi fi dad, let's go and have a gig. No. Dad had his position, my grandfather had a position. We have actually sort of tried to be, we have moved certain relationships to be trivialized to, you know what, I'm your friend. I tell my sons, I'm not your friend, I am your friend, but I'm your father first. And you better listen to me when I tell you, pay attention. They still don't, but but I still try to pretend that I'm their father. But on a more serious note, if we don't discover our whys, trust me, I can stand here and talk all about patient experience, self-development, and Jay can do an amazing job of IBAR, and IT can do an amazing job of digitizing everything. But if people don't grasp the why they're doing, why is IBAR, why is the JIVEX, why are we doing it? And that takes me back to Jacob Chandy, 1940. And his quote was, he was a professor emeritus of neurosurgery. And his only simple quote for his students when he was asked to give one of these lectures, he said, the only thing that matters is the patient. The only thing that matters is the patient. It is not how much knowledge you have, what robot you use for surgery, what technology you have. None of that matters. The only thing that matters is the patient. Have you as a physician, have you as a nurse, have you as a healthcare provider, as you as an organization, are you connecting to your patients? If you're not, we are stuck. What do? We're a healthcare provider. And what kind of a healthcare provider? A mediocre to a low level healthcare provider. When I first came here, my first year I was walking around and learning the things about the American Mission Hospital, and a term came into my head. This is not a term that is used here, it's a term that is used in India more often. And I looked at AMH and I said, this is a nice nursing home. A nursing home is where patients come for diseases, and if you've got a real disease, you're referred out. And if you're dying, you're desperate with no money, then you're admitted and taken care of. Okay? You're not a real hospital. You're a nursing home where you do first aid dressings, band-aid. If you've got a wound, you can stick a band-aid and say, if you've got a deeper wound that needs suturing, I will refer you to the local hospital 200 yards down the line. Like today, or if you want to do an ultrasound fast and get the result quickly, go down and get, without naming the hospital, I'll say go down and get the ultrasound there. They'll give you a quick turnaround time. So this is what I found about 9-10 years ago. Was I disappointed? No. Because that's how a lot of these mission hospitals were. They were doing a mission and they didn't even realize what a mission was. Because the mission is to provide outstanding healthcare of high quality to the people at an affordable cost. That's not how we provide healthcare. And so everything that I have done and pushed in this organization is to first bring quality as the foundation on everything that we do. It's nothing to do with cost. Quality is free, by the way. It's an attitude of thinking that you need to think differently to make sure that the patient sitting in front of you needs to have safe, effective patient care in a timely way that's affordable for him. And so it was a very simple concept out of a complex science that Deming had actually described in the 1940s, 1950s. And every healthcare institution in the US and worldwide have adopted that. And certainly we've adopted it, that we have actually risen quite dramatically. To be diamond rated twice, it needs a lot of knowledge on all of these things. But I still repeat to you and say this. Many of us still do not understand the why of our own individual purpose in life and what that purpose has brought us here to align with the why of this organization. I drew this thing up. The why of the organization has to perfectly align with the why of the individual. When any new staff joins AMH and any staff separate from AMH, for example, resignation, I normally read the resignation letter. Why is the staff leaving AMH? And then last week I saw 2 resignation letters. I got a better offer in another hospital. Now, the question is, the better offer in a new hospital just means 2 things to me. One, we as AMH has failed that particular employee to discover that employee's why. It's a total failure. absolute failure of the organization or the supervisors of that particular employee to having discovered that patient's why, to pinpoint, to allow that organization, that employee to discover his or her why as to why that employee should actually work in this organization. And what the why of our organization can align with the why of this employee, so that it is not happiness, it is the fulfillment, is the end result. Happiness comes from, you get a 50 BD, increment that will make you happy for 2 days. It doesn't fulfill you anything more. It absolutely does not fulfill you at all. But the fulfillment comes from, let's say you get an extra 50 BD in salary increase. That 50 BD that you get can be used for somebody else, not for you to buy a new dress or buy whatever it is. But if you can use that 50 BD to make a difference in the life of another human being, then that brings you fulfillment. But unfortunately, a lot of our employees are still stuck in this what mode. And I challenge you all today. Firstly, to discover your own whys. All our whys could be different. But ultimately, there is a greater purpose in us breathing and being alive and being here. And if we truly understand and discover the why, then you will have to then ask yourself, does my why align with the why of this organization? And if your why does not align with the why of this organization, then I urge you, this is not the organization for you to work. You need to leave this organization and find the why, your why, in the why of another organization that is perfectly aligned with you. And I'm very serious when I say this, is because when the why does not align with the why of the organization, we have a lot of people floating around in the outer circles. That is completely non-productive and ineffective for the organization. Forget the organization. You become a problem for the very patients you see. Because patients come to you in absolute trust. And the patients can no longer trust you because your why is focused elsewhere. For me, I can only tell you about me and what my why is. My why is 100%, not 99.9%. My why 100% is about utilizing my time, my talents, and the gifts God has given me to improve every single employee's, and I wouldn't even call it employee experience, but help the employee discover their whys in this organization. And if on discovering your own why, this is the place for you not to be, then so be it, that's okay. I want you guys to move off and find your whys and be successful in whatever role God Almighty has called you to be successful. And I will end up with just one other story of my life. And this happened in 2008. 2008, I was finishing off a management course, in a university somewhere in the US. And the professor who was leading the class came to us and said, and we were a class of about 60 students there. He came into a class and said, within 1 year, he said, within 1 year, 30% of you will change jobs. We said, no way. I mean, and in this class of 60, these are all very senior people. Senior people who are working as CEOs, CEOs. I wasn't a CEO, I was certainly in a very good position working in Aramco. And he said, 30% of you sitting in this class is going to change your jobs in a year. And we said, come on. And then he also gave us another thing we didn't believe. He said, we have stats for the last 25 years in this course that we have kept track of. And in every single class over the last 25 years, the median number that changed jobs was 30%. Trust me, 2009, I was in AMH. 2009, I was in AMH. And I look back and said, oh my God, I'm that one statistic that she was talking about. And you know what happened? And I'll tell you what happened. After 18 years working in Saudi Aramco, doing the things that I just loved, that made me happy, it didn't give me fulfillment. After 18 years there, I discovered my why. I discovered my why. And as soon as I discovered my why, I said, no amount of money, no amount of position, no amount of comfort, no amount of whatever I enjoyed was good enough for me. I need to go and pursue my why. And I came to pursue my why in a small hospital that I thought was a nursing home in Bahrain. Today, we have flipped it. AMH will be the most outstanding, forward-looking, futuristic healthcare system, not just in Bahrain and the GCC. This is not an empty promise, but this is a dream that is being realized as we speak. And now if I look back at my 10 or 11 years here, the only thing that kept me going, despite the disappointments and the discouragements and all of the things that you have to face as an individual, as a human being, the only thing that kept me on my job, focused on what I have to do, was I discovered my why. That why was so powerful in me that nothing that came up as a storm that hit me, I mean, you can't have a bigger storm than COVID that's completely knocked us off. But my focus is still on building AMH. Yeah, the storm has hit us, we need to realign, the numbers are off and so on and so forth. But we are an organization that is resilient, meaning that despite the shock, we can get back and carry on to fulfill our mission. And the only way we're going to do that is I have at least, I would say, 500 employees committed and discovering your own personal whys. Because if you do that, then the why of the organization will perfectly align. And then there is nothing on planet Earth that can stop us to be the organization that we have to be. So go, my friends, and discover your why. Thank you, and have a good weekend.